piece. So the allocation process isn't really going on anymore. It's by order. So I'm curious, what's the primary focus for you on your end as far as getting vaccines out at this point?
So right now, providers need to order on a regular basis, and then we fill those orders. And so the important thing is making sure that we're able to get those out to them. And then now we're really focused on a couple of different operational things. So first and foremost, really looking at the data for vaccine uptake and seeing where we may need to do things a little bit differently. But the other piece is really making sure that all of our providers are connected in with our communication efforts and really trying to get the people on the ground know where the vaccine is, and then make sure that we're able to bring vaccine to where some of the people are and they may not have regular access to it.
You talked about uptake. So the president's goal is obviously the 70% for adult population by 4th of July. We're not near that mark. Well, I say that. Do you think we'll hit that goal?
By July 4th, probably not. We know that the vaccine demand has definitely slowed down, particularly after the J&J pause. The one good thing is that with the announcement of the adolescent vaccines, we actually have seen an uptake in the data for doses administered now that the 12 to 15-year-olds are now eligible. But we know that it's still significantly less than what we saw previously.
I will say that on the media calls, I wouldn't say defeated is the right word, but it seems like you guys feel a little bit saddened when you talk about the demand dropping off. Did you expect it to drop off this fast? Do you expect it to be stronger? I mean, how do you feel about the level we're at right now with vaccinations?
So obviously I'd like to see it higher. That's one of the things that, we are really trying to do a lot with our communications and outreach and media, trying to really, get people to understand the importance of vaccines. But one of the things that, while the numbers are not as high as before, we still are seeing close to 1 million doses administered every week. Now, this is still, first and second doses, but it's still a strong showing of what our providers are able to do across the state.
So we've seen other states pick up incentives, right? I think Ohio's governor tweeted about an hour ago that you're laughing, the $1 million lottery program is clearly working. He said that, they're still seeing, record demand. So it shows that maybe there are actually people on the fence. Why is Texas not following many other states who have seen success with these programs and having some sort of incentive on a statewide level?
So every state is different, and what they can and can't do legally varies. We have looked out across the state what we could offer as incentives, and ultimately our guidance has been is that really needs to happen at the local level. We also don't want anyone to feel like they're being coerced into getting vaccinated.
So are you talking to local providers? I mean, what are you telling them in terms of, hey, you guys can do this, but we can't? Are you saying that's the law, basically?
So we encourage them that where they can. So some providers are offering cash incentives to their employees. Obviously, as an employer, you have different ways to be able to communicate with your employees and things like that. And so, we always want to hear about those things so that we know that they're going on. But at the end of the day, it's their choice for them to be able to offer those things.
So I want to look ahead for a second. When we talk about children 12 and below or under 12, we could possibly see them become eligible here in the not too distant future, the next few months. What is the plan for when they become eligible? Oh, Imelda, I think you're frozen. Sorry. Imelda, can you hear me?
Yeah, you were frozen for me a little while ago.
Okay, I can hear you. All right, now your video.
Okay, I can. Now you're back.
So yeah, I was saying, so 12 and under might become eligible soon here in the next few months. I wanted to see what is the plan for rolling the vaccine out to them.
So what we do know is that the FDA will meet in early June in order to give the industry guidance. And so this is essentially their direction to all of the manufacturers about the data and kind of the standards that they're expecting to see within that population. We know that, we've seen a lot of excitement and anticipation of that for the 12 to 15. When we do have which will typically be 5 to 11 years of age, will be the new age category that will likely come this coming fall. It will come right when, likely right after back to school starts. And so we know that kids will need to be getting their, back to school vaccines for those that are required. The other piece of that is it gives us more time to have additional conversations with parents about considering the COVID-19 vaccine for their family. a lot of the feedback that we've heard is that the parents are very eager because they may have grandparents living at home with them, and then protecting the kids is another way of cocooning, the older adults as well. And so we are excited to hear about the potential for additional age groups to come eligible.
You say parents are eager, but I think there's also, we've heard a lot about parents being hesitant, saying, oh, my kid won't get sick because kids don't get sick with COVID, which is kind of not accurate. But what is your message to parents who are hesitant, or on the fence, maybe got it themselves, but say it's not for my kid,
So what we do know is that the Pfizer brand of vaccine has had hundreds of millions of doses administered across the globe. And that has provided a lot of data about the safety of this vaccine. When we look at protecting a community, there's no way for you to separate out the children from the community. Our kids are part of that. And in order to have the most protection, not only for our loved ones and our friends and our families, but for the community as a whole, you have to look at the children as part of that vaccination effort. And so this would be another key step to helping us get Texas back the way that we used to have it.
When you look back on the rollout, what do you think worked, and what do you think in hindsight probably could have been done differently?
I ask myself those questions almost every other day. I think what worked really well is our provider base. They stepped up to the challenge each and every day, no matter how hard of a goal we had for them, how fast we asked them to, hit certain numbers. And really accepting that challenge and getting out there full force to get as many Texans vaccinated as possible. So first and foremost, that is a huge kudos to all the providers, because I know it was blood, sweat, and tears 7 days a week for a really long time that, we had some of those big numbers. I think in hindsight, some of the things that we would potentially do differently is talking with different age groups, at different times. While we had the eligibility kind of progress along those ways, absolutely the data shows out that it has, worked enormously well as far as reducing hospitalizations and deaths. But we know that within the younger population, young adults in particular, that just as what you were saying about, well, the kids don't get sick, a lot of them still have that perception of, well, I'm not going to get that sick, and so it's not that big of a deal. I think in hindsight, I probably would have really focused more having that conversation earlier with them.
Is that where the focus is right now? I mean, is it people in that 16 to 35 range or so? We've seen that seems to be the slow uptake as far as vaccines.
Yeah, so we're definitely, trying to have a stronger conversation with that younger age group, as well as, with parents for the adolescents as well. Our regions, our public health regions all across the state are really targeting the different rural areas, reaching out to faith-based organizations, bringing the vaccine to them, having conversations with local leadership in order to really have encouragement across the board, particularly within that younger group. And so, we're also putting out some additional dollars that will be coming out for vaccine education that will be really leveraging that grassroots effort as well.
It seems like the time that 5 to 11 age group might become eligible is about the time where these vaccine manufacturers are saying, hey, a booster shot could be needed, 8 or 9 months later. Well, for at least the people who got vaccinated first, that would be right around the corner, basically coinciding with that back to school time almost. Are you guys already in the works as far as how do we distribute that best? Is it going to be just pharmacy level, or are we going to have hubs start back up again? I mean, what's the way to do that?
So we have most indeed having conversations about potential booster doses as well. And, we're very different position than we were, in early January, where supply was so limited. So if supply is not the limiting factor, people will be able to get their booster dose at their convenience whenever and wherever they can possibly find it. And that's really a game changer. We're not having to funnel everything through only a certain number of straws because there's only so much vaccine to go. And so we had to really route people to those hubs in order to get, bigger numbers pushed through. That is quite frankly the biggest difference from where we were in January and February to where we would be come the booster dose. The other piece is depending on what CDC does, they potentially will open it up to just providers ordering it directly from them. I don't know when that will occur, but when it does, that is definitely a bit of a different stage for us as well.
So do you think hub sites will just end up kind of fading away and we'll go more your local pharmacy, your local, whatever it might be, doctor's office? When do you think that transition happens, or if ever?
So I think we've already started making that transition. Most of our hub sites are not running the same kind of big numbers through on a regular basis. Now, a lot of them still may be ordering, particularly in our hospitals where they are serving adolescents. Some of them are still ordering a significant amount of vaccine, but it's not to run through in a hub style event forum type of thing. It's more about people scheduling appointments, coming in on a more routine basis. And so I think from, all angles, we've already made that change.
I have to follow back up on the incentives thing just real quick. Are you saying that you've looked into it and Texas law does not allow for a statewide vaccine incentive program? I'm just making sure I understand what you're saying. You said looked at the law or legal, what you can do.
So we were looking at what are all the parameters within Texas. To put up state revenue dollars for a lottery is not necessarily a feasible option for Texas. And when we looked at what are all the options on the table, we really felt like we need to leave that up to the locals. Texas is a home rule state and most decisions are made locally. And that's one of the things that we decided was best left there.
But demand, as you pointed out, is kind of falling. It kind of ticked back up when 12 to 15-year-olds became eligible. But do you think that that's working well enough? What's the next thing to try to get it up? Or are you saying kind of we're going to basically slowly taper off as we head into the fall until it's time for a new age group or boosters?
So I don't know that it's going to taper off even further. I think the biggest thing that we're trying to do right now is make sure that it's widely available. So whether you go to the grocery store and you realize you haven't had your vaccine yet, there is no line waiting for you, that you're able to just walk up and get it at your convenience. And that's really now that the supply is more readily available, we have a lot more access points than we did in January and February. And so that's the piece. We have a lot more providers administering a lot more doses that we can keep the pace, even though we may not be having somebody put up 10,000 doses at a time.
And I know you're tight on time, so I'll wrap it up. When you're looking at the data, the uptick you said is kind of what your day-to-day is. What is it telling you, at this point? Is it telling you that there's an issue in a certain region? There's an issue with a certain age group? What is the data telling you at this point when it comes to vaccines and the rollout?
So what we look at is really trying to track change over time. And so seeing what the vaccine uptake at the county level for different age groups is. And ultimately, we want to see bigger and bigger increases in that. Now, one of the things that in looking at some of the recent data, I'm really happy that we have seen a lot of the counties actually start to really increase their uptake within particularly, some of the younger population groups. Now, we still know that vaccine uptake is a little bit slower in our Louisiana border area and the Northeast Texas border. So up in the Texarkana area, Paris, Lamar area. And so those are always areas of concern that we want to make sure that we're doing really a much more targeted outreach. And our DSHS public health regions out there are taking extra efforts to really connect with the community and make vaccine as easily available to the point where they're doing a lot of homebound initiatives. And then if they know that someone can't get off work, they're even taking the vaccine to where some of them are employed as well.
Anything else that you wanted to share? Any final message that you just kind of want to get off your chest and let as many people know as possible?
So first and foremost, that vaccines work. Texas has made big strides to get a lot of people vaccinated, but there's still more work to be done. And for those of you that may not have gotten your vaccine yet, we want you to know that it's easily available. You can go get it now, any place, anytime. And then the other part is that remembering that second doses are still really important. And so for, the mRNA vaccines, they're highly, highly effective. Please go get your second dose.
Is that a big problem? I know I've been asking for those numbers, on a weekly basis. It seemed like almost, I don't know the percentage, maybe 8 or 9% of people were not going back for second doses. Is it still around that margin, or is it, do you have a count roughly?
I don't remember the exact percentage off my head, but what I do know is that a lot of them are not happening exactly on week 3 or 4. A lot of them may be taking a little bit longer. in some of the data that Pfizer's been putting out recently, the longer, the second dose comes in actually, has really positive results in some of the data. So even if it's beyond that, 2-week window of flex time, we still want people to know that even if you're beyond that 2 weeks beyond it, go back for your second dose. It's still important to get it.